Okay, fantastic. So before we start getting into the meat of the forum, I'd like to acknowledge the Dharawal people as the traditional custodians of the land that I live and work on. I value and celebrate the Dharawal culture and language and acknowledge the Dharawal people's continuing connection to the land, sea, and this community. We pay respects to the elders and their families past and present, emerging, and through them to all Aboriginal and Torres Strait Islander peoples. We're coming together today from all over Australia, but Dharawal land stretches just south of Botany Bay, down to Nowra, west to the Georges River. I acknowledge and pay respects to Aboriginal and Torres Strait Islander people joining us today as well. I also want to take a moment to acknowledge the consumers on this forum. So those of you with lived experience of chronic pain can teach us so much, and that results in better clinicians, better interventions, and novel ways of solving and managing your conditions in a way that actually fits in with your lifestyle. So this really is a two-way conversation or a multi-party conversation, and we just appreciate that you're showing up, you're sharing your stories, you're asking your questions, and you're challenging the experts. That's doing so much to help yourself, but it's also doing so much to help this entire community. And I just want to acknowledge that you're probably pushing through some pain today to be here. And thank you very much for doing that. My name is Landell Archer. I was a treating exercise physiologist for 5 years before finding my purpose in digital health, which has been the last 15 years of my career. I'm currently the Director of Healthcare and Government Solutions at PEXIP, where we focus on telehealth. Using video is a big focus for us. But my passion project is to work with the Painaustralia team. We've developed an app called Kaha. So I manage the Kaha Health Solutions, and that's for people who are experiencing chronic pain. After watching my husband suffer with debilitating pain for 10 years, we got him pain-free, and he's been that way for 18 months. That gives me hope. So we've launched, we've partnered with Painaustralia to launch an app that kind of combines all of what we've learned, and that'll be launched later this year. Housekeeping, please put your questions into the Q&A and we will endeavour to answer them. But we've already received so many questions from the group and we'll be addressing those first today. Okay, so the topic today for the forum is there hope for long-term pain? Now, we've assembled 5 panelists to give their honest opinion on why there is so much hope for people experiencing chronic pain. And I would like to introduce the panel with a brief bio on each and then invite them to give us a bit of a summary of their story. So Julia Jones, Painaustralia CEO, is a dynamic and highly accomplished political and not-for-profit leader with broad experience, including as the ACT Shadow Health Minister, Deputy Leader of the Opposition, and trade unions, board directorship, media advisory, and federal and state policy development. In addition to the vast governmental expertise and established valuable networks. So Ms. Jones not only has a deep understanding of the health system, but a genuine empathy for people suffering from health-related issues born from personal and close family experience. And I know that just working with you, Julia. So over to you first.
Thanks, Landell, and welcome everybody to our forum today. It's very exciting to be online with everybody, and I hope many people will be watching this forum back afterwards as well as they relax in their own homes and take in information about chronic pain and the hope that we aspire to for people who have developed chronic pain in their lives. Here at Painaustralia, we see our role as definitely to be the conduit between the community of people living with chronic pain and those who treat them, along with those who research what possible future treatments we might have with government and with the media, and certainly with the big public conversation about chronic pain. Chronic pain is under-recognised, under-respected, and we need to see a big change in our community with how we relate to people living with chronic pain, where we respect them a lot more. So that's a big part of my job, is to get that conversation going with government and in the media, and to get the respect increasing. So then the things that I see as our role to do over the near term is to protect the treatments that you have available to you now, to not judge people for the treatments that they choose or that are effective for their bodies and with the knowledge they have of how their bodies work. We believe consumers are experts at their own health and their own bodies. We believe that multidisciplinary pain management is the key to the best possible outcomes that we know at this point in time. And we would like to see that available to more people. We know from research that only around 1 in 100 people with chronic pain actually access multidisciplinary pain care. And all those present here today know something about that, and some are great experts in it. I am not an expert in that. I come from the political world, but I know how to get conversations going with politicians and with the media. I believe that we should see more options for the treatment of chronic pain. We should see more research, and the research should be driven by consumers into what they want to see, so that we don't see treatments necessarily just that are great profit makers for business, but also treatments that are the right thing for the human body. So we've got great professionals here today. I hope they're able to help you. I hope I'm not a big part of the conversation, because we want to hear from you and we want to hear from them. But thank you for coming today, and please do engage with our Walk My Pain website, which Landell will talk about a bit later. And we would love to hear your story. We thrive on and do our work based on consumers' own stories. That is our bread and butter, and that is how we will change the perception of pain and the treatment of pain in Australia.
Thank you, Julia. Next is Ben Nihill, who's a consumer. Ben is our youngest consumer advocacy group member, just 20 years old. Ben's health took a bit of a hit in 2017 when, in the space of 4 years, he suffered repeated bouts of influenza, sinus infections, glandular fever, and chronic fatigue. By the end of 2021, Ben was bedridden and in constant pain, and eventually in 2022 was diagnosed with inflammatory arthritis, fibromyalgia, and erythromelalgia. Sorry, that word always trips me up. After some drastic changes to his lifestyle, including diet, physiotherapy, and trialing several treatment options, Ben is doing better at managing his health. And while his quality of life has improved dramatically, he still continues to try new things. Thank you so much, Ben, for being here.
Yeah, thank you for giving me the opportunity to tell my story. So yeah, I got diagnosed with fibromyalgia over 2 years ago. So fibromyalgia is a chronic condition, and the two main symptoms are pain and fatigue. I was bedridden for almost a whole year. I was only, 17 to 18, so it felt like my youth was kind of stolen from me. I tried so many different medications, and I started going to physiotherapy, but nothing was really, helping me through it. And I kind of got stuck in that for a while. And, I tried so many different things. I've had ketamine infusions, I've had lignocaine infusions, I've had injections. I made some really big changes to my diet and my lifestyle. So I think that helped the most out of everything I've done. Just, trying to exercise daily and eat nutritious food and stay away from processed foods. I was so unwell for about 2 years, and I could barely do anything. But, after consistent efforts for a while, I've really, I've been going to physio every 2 weeks, and I'm able to kind of pull myself out of that rut. I still do have chronic pain daily, and although my symptoms are still there, I have been able to improve my quality of life with the help of a good team, a psychologist, a physiotherapist, pain specialist, and my GP. And yeah, I was so unwell and I almost given up completely, but I kind of just consistent efforts over time, I was able to kind of improve my quality of life and be able to do more activity. And now I can go out and do exercise with my friends and do normal young people things with, I still find it difficult, but I haven't, before I was completely bedridden, I couldn't do anything. So from where I started and where I am now, my life's improved a lot.
That's great to hear, Ben, and we're really happy that you're pushing through that, and we're looking forward to hearing your point of view on this. Joyce McSwan is a pharmacist. She's a multi-award-winning clinical consultant pharmacist, and educator within the field of pain management. She is the clinical director and author of the Gold Coast Primary Health Network, Turning Pain into Gain program, and managing director of PainWise. She was recently awarded a fellowship by the Pharmaceutical Society of Australia and is the current president of the Australian Pain Society. Her expertise lies in innovative health pathway design, piloting and implementing value-based models of care within the primary care setting, utilising mixed funding models to optimise pain management and chronic disease management. Thanks for being here, Joyce.
Thank you so much for having me. Look, it's just answering your question about whether, is there hope? There's always hope when you have humans involved, because we're complex and we can solve solutions. And the ability to be able to problem solve gives us the opportunity to actually have hope. So, in any dire situation over history, humanity is incredible. Humanity survives. We are built to do that. And humanity has its own way of solving problems. So I think people who are listening or will listen will probably resonate well with that, because you're surviving. Now, of course, we want to survive well. So in the area of chronic pain, I've been in this area for some 20 years. In fact, not many people know this, but I was a child carer for my mother, who lives with pain. And from as young as I can remember, we'd come home from school and we would be the carer for her. So it was just the norm in our lives. And she was incredibly self-managed in her own way, no pain programs at the time. And she was simply solving problems and surviving. And until today, she's an incredible survivor of that. So, but as a practicing clinician and working with people with pain, three things that I've seen in the last 20 years in particular, because that's really when other than my own sort of lived experience, three things that I feel really have evidence, strong hard evidence in the fact that there is absolutely hope. Three things. One is, I feel like we are really understanding in the realm of science, really understanding more and more about the pathway of pain. Once upon a time, we thought it was, the old Descartes model where it was just a stimulus and that was it. And that was very invalidating as a model, because if you had no stimulus, then it's like, you mustn't be in pain. So some of that noise that we still hear about, oh, I'm not believed, and, they can't see it in an X-ray. So therefore, I don't know where's pain coming from, but I swear to God, I'm feeling it. So that kind of disbelief is really profound. And I feel like as the body of science and that, I'm a clinician, I'm a scientist, we are understanding that more. And that's almost like we've just, opened this other universe of this really exciting place. And I know our researchers are working hard in that area. So number one, I think we're really understanding pain. Number two, we're less silo. So we are now working in a less silo environment as in the medical culture. It's still getting there. Systems are still catching up. And the last thing I feel that why we've got hope is we are starting to understand what we call value-based care, which means that we're going to spend our money better and more efficiently for you. And that's all our taxpayers' money together. So that's my quick 3-minute job on why I feel, that there is hope ahead.
Thanks for sharing, Joyce. It's really helpful. Over to Jessica Cassidy. She's our second clinician on this panel. She's a physiotherapist with 20 years of clinical experience and a special interest in treating people living with persistent pain. She has worked in public health, hospital settings, private practice, and in professional sports as well. She is currently working for a multidisciplinary practice called Sports Lab, which is a leading practice based in Sydney. Hi, Jess.
Hi, everyone. Thank you so much for having me today. It's such a pleasure to be here. First off, I just want to give a big clap to Ben for sharing his story, because that takes a lot of courage. But it also gives a lot of people a lot of hope that, one, they're not alone. And I think that is really important when we're talking about endeavouring to join people on their journey to manage pain. So how can physio help continue to maintain this hope? And I just want to kind of keep carrying on where Joyce sort of started, in that it is really exciting. We are starting to gain more and more understanding and knowledge about the processes associated with living with persistent pain. And as that knowledge starts to build and as it started to filter across through the different professions, we can start to implement that more effectively with our patient cohort. Physios in particular, I mean, I know I'm biased, but we are blessed with a couple of things. One of those is that we are able to spend time with our patients, and that time allows us to really actively listen. And I think that that is something that anybody I've met who's living with persistent pain really needs. Somebody to empathetically listen, understand, and connect with you as an individual. Because once we can do that, once we understand the individual, we can then start to identify your goals, the barriers to achieving those goals, and then work collaboratively with you and your whole care team to find strategies to help you achieve those goals. Now, the other thing that's really hopeful is we know, and as evidence is starting to show us, there are many things that do work. But what we need to start to identify is how those things work for you as an individual. So I just wanted to say thanks again for having me here. It's really exciting to share more knowledge and stories and connect. And I think that is what really gives me hope and my patients hope. So thank you very much.
Thanks, Jess. Introducing Dr. Chris Hayes. He's a pain specialist, a specialist in pain medicine who works at John Hunter Hospital in Newcastle in New South Wales, and has been director of the Hunter Integrated Pain Service since its foundation in 1997. Pain's come a long way in that time. He's the past dean of the Faculty of Pain Medicine, Australia and New Zealand College of Anaesthetists. Another additional roles of that Chris has had include co-chair of the New South Wales Agency for Clinical Innovations Pain Network and chair of the Pain Management Clinical Committee of the Medicare Benefits Schedule Review. His research interests include a whole person approach to pain, outcome measurement, and the redesign of health systems to achieve greater integration between specialist pain services and primary care. How do you have hope, Chris?
Landell, thank you. Hope is a good theme. So over the years, as you mentioned in the introduction, I've been a pain medicine specialist in the public system in Newcastle, John Hunter Hospital. And during that time, I think one aspect I wanted to highlight is seeing the rise of multidisciplinary care. So other speakers have talked about this, but I think there is great hope in going broad. I know in our team, we talk about broad in a 5-point plan. I'm holding up my 5 fingers there, hoping people can see them on screen. So the thumb representing the medical aspects of care, which is part of it. And then beyond that to the mind-body, the way that mind and body connection, activity, and nutrition. So I think that's just our way of advising people to go broad. I think there's much hope in going broad. The other aspect, I think Jess was mentioning this, Ben was touching on this as well, is to personalise it. Because if you just go broad and do the same thing for everyone, then that doesn't work so well. And perhaps this is the rise of the consumer movement in health, just bringing out the importance of being able to individualise approaches. Ben was talking about his nutritional changes, which is one of those points of interest to me, and how he's had great benefit from that and the exercise. To individualise that, though, I think is the key, because what works nutritionally for Ben and exercise for Ben may be a different thing. So those were really the 2 broad points that I think emphasise hope. Going the multidisciplinary path, going the broad or the holistic path for one, and then within that framework, just personalising it and figuring out what is it that works particularly for you. I think in doing that, going broad and personalising, there is much hope.
Thank you, Chris. I think everybody on this panel will agree that the most important person in that multidisciplinary team is the consumer themselves. And there's so much that they can advocate for themselves, and there's so much that they can teach the clinicians around them to make that personalised care. Which brings us to Kim Allgood, who is another one of our lovely consumers joining us today. So Kim has been working in the not-for-profit sector for over 2 decades, She's presently the secretary of a registered health promotion charity, having also served at executive levels on a number of community organisations. Kim's time as a lifeline telephone counsellor led to further education in community development, shaping her future directions. With half a lifetime living the reality of persistent pain and invisible disabilities, Kim's knowledge and broad spectrum of experiences creates interesting coffee conversation for sure. Hungry for further assistance and awareness for all of those affected by chronic regional pain syndrome, CRPS, and other persistent pain conditions, Kim and her carer founded the Purple Bucket Foundation in 2011. Kim has come to believe through both lived and learned experiences, a team is required for successful pain management. I think there's a theme here to this panel, and a team where the patient is the central figure. For this team to work together, it must be built around education, communication, trust, strength, support, faith, and honesty. Kim, can you tell us a little bit more about your story?
With pleasure. Firstly, I'd like to thank the three specialist professionals on the panel group together. The three of you have basically summed up the main point of there being hope. Dr. Chris talking about it being about the individual and what works for one, not necessarily working for another, so it's got to be personified. Joyce, just everything you say about being a pharmacist and the requirements and what have you is just incredible, and more consumers need to speak with their pharmacists and understand how everything works and how much help our pharmacists can be to us. And Jess, our physios can be incredible people, and working together with our physios is truly the basis of a lot of hope for a lot of people. So thank you. In regard to hope, I've been told many times that hope does not cure pain, but without it, we will never find the basis of getting through our pain. So hope is such an important thing. It's also a personal thing, a lot like our multidisciplinary teams. We don't all need every member of the allied health community to be on our team. We need a personal approach to that, but we also need to be the main member of that team so that we get what we need out of it. So for me, I have a physiotherapist, I have an OT, I have a GP, I have a pain specialist, and I also have a very strong mental state of mind now. I didn't for the first 15 years. I was pretty well, I can honestly say, hopeless until I learned how to do a lot of things for myself. I learned how to meditate. I learned all about neuro-linguistic programming. I learned how to help myself. I learned that hope was such an important thing. I learned how to accept where I was in my life and that my pain was what it is, and that the same as Michael J. Fox says in his quote, acceptance doesn't mean resignation. It means understanding that something is what it is and that there's got to be a way to get through it. There always is if you work on yourself and hold space for yourself. Just like we are taught to hold space for someone else, you have to learn how to hold space for yourself. Sit with yourself. Learn that you need to be nurtured just as much as you nurture your friends. You need to be there for you too. And that really is the main part of there being hope. To be hopeful for yourself as much as you are for everybody else. And that's what works for me. And I don't know that I can say much more. Thank you for having me.
Thank you, because we will come back and we'll ask you some of those tricky questions that the consumers have come to us with. But we are going to start with an easy one. So Dr. Chris, this one's going to you. The latest research always gives us hope for better interventions in the coming years. And this is something that, you know, the research has been dramatically different from 30 years ago, and the things that we're learning from the research is dramatically different. So the simple question from our consumer is, tell us about any interesting current research, please.
It's a good question because there is a lot of research going on in different areas. I think Joyce was touching on a key point. A lot of recent research talks about the nervous system and the power of the brain and so forth. So these are the pain-related pathways. We've been learning a lot more about that from a research perspective, which is to say that if one has pain in the knee, it can be in part what's happening in the knee, and then there's another layer of what's happening in the nervous system on top of that. So we're learning a lot about the different cells within the nervous system and within the brain. And on the hope theme, we're learning about how those things can be retrained. So that is a big area. I think another two areas just to mention briefly. I think there's a lot of new research looking at the emotional aspects of pain, and this is to do with the mind-body connection, which is not necessarily relevant to everyone, but can be relevant to some. And this is, for those who are interested, potentially related to earlier life events and traumas, that for some people there can be value in delving into that emotional angle and seeing that that is a way to wind down the nervous system. And the third point, Ben was mentioning this, the nutrition side of things. I happen to, because it's my area of interest, be doing a PhD in this area. A lot of research at the moment looking at the power of nutrition to, again, influence pain-related pathways in the nervous system, influence our physical and mental health. So there's a lot of interweave in that and the benefits of nutrition. So I would say those three areas: nutrition, emotions, and pain-related nervous system pathways are key areas of hope in the research world.
Yeah, excellent. We're seeing lots of exercise related to those three things as well. So even things like trauma-informed yoga making its appearance in common places as well. That's
true, they interweave. I would say that, like, they're not distinct. I know when I was putting up my 5 fingers, exactly as you point out, Landell, they overlap a lot, and we know that, you know, how we move and exercise and how we eat impacts our mental health in profound ways, and all these things interweave. So, you know, hope for the individual is in finding that leverage point that they would like to start with, which might be exercise or changing eating or doing some more emotion counselling type work. Any of these things can be a starting point. Yeah, and with so many places that we can, you know, so many levers that we can pull, I suppose, that does give us hope. Now, Joyce, as the pharmacist in the room, I'm going to throw the tricky questions to you. Many of the questions that we had come through from the consumer group were regarding opioids. And this particular consumer framed the question in such a great way that I thought was representative of so many people and what they're experiencing. So I'm going to read this to you because this is what they write, and I'd love your honest opinion. Hi, opioids do help chronic pain patients along with safe exercise, mental health support, mindfulness, and other positive social activities. So you can tell that this person's trying everything. So why do medical professionals believe that they are not helpful and make us feel like we are drug seekers? I know each patient is different and needs different treatment. I am just talking about the patients that do get relief from opioids. This makes the chronic pain community feel so judged and not heard. I have been using opioids along with all of the above that they mentioned, and the opioids do help my pain immensely. I've not increased my dose in over 8 years. We need to be heard and believed. How can you help our community help with this? Sorry, how can you help our community with this?
Yeah, excellent question. And I love questions like this. And yes, I appreciate that this is a question that's been raised by many people. And we must understand, first of all, you know, why are these questions being asked now? And then I'll start with that so that we understand the context of it. And then I'll go to what you know, we can do about, you know, the feelings of being judged, and how we can proactively understand where drug therapy fits in pain management. So as Dr. Chris alluded, we've come, you know, through an era of research And we're still charging on, into this galactic space of understanding what nutrition does now and what, what emotion does. With the lack of that understanding, we grapple for tools. So for a very long time, since pretty much the discovery of opium, our poppy plant, which we went, wow, really helps with pain, and it was used largely in the cancer area, but not understanding that cancer pain is quite different from chronic pain, and there was a lot of that lack of understanding. So having said that, we used the tool that we thought would help with pain, and unfortunately, it's a single molecule that goes to a single target site. So we must understand with drug therapy that with any drug therapy, there's usually A will equal B, and that's all, especially with synthetic drug therapies, it will do. So pain is definitely more complex than that. As Ben said, I found actually diet to actually help. Lo and behold, Chris is doing more work in that area and so on. So I think, first of all, having prescribed that and what have you, that's where we were. And that's where the context of it is. Now, as research has changed, we have found so many other things that has helped. And I really love the question in terms of the fact that this person is having a tool, which is an opioid or even an analgesic, let's call it, that is part of a toolbox. So if it's part of a toolbox, then it is like every other tool, if it's used that way. I know it's not the way it comes across with prescribers necessarily. Now, so why are prescribers so fearful or so, judgmental about it? Of course, I can't speak for all prescribers, but this molecule, opioids, has a tendency for dependency. It's a risky drug, it's a potent drug, and there are regulations attached to that. So when you have science and regulations and changing science, you have a really complex situation there. So we're in the times of transition, and when there's regulations that's really, risking the prescriber's livelihood potentially, they also have to think about, how am I going to frame this up, and give you safety, but also give you options. But I also have a limited time frame in doing that. So we are in challenging times, and sometimes that experience that you get is a combobulated everything there, at the same time. I know many clinicians do try really hard to understand pain as well. So it's very complex, and I don't have enough time to go through all the complexities. I think what's important is what can you do about it. I think I'll finish with that. I think having a good ability to negotiate with your prescriber all the things you're doing about pain and pain management is a really good place to start. Book a long appointment so that it's not trying to be jammed in that time. Find people you can work with. Doesn't matter if the first one doesn't work out. It's okay. You go to the next one and have a really good conversation. I do all these things. Is there more I can do? Opioids play this part. How can you support me? I support you. Start at least there, okay? Because then I think from there, you've got someone you can work with. And we are in a moving space. So I think keep having these dialogues.
Yeah, so just to add to that answer, I think it's worth acknowledging in the room the elephant, which is that we have had changes to opioid availability over the last couple of years. They were unfortunately brought in during the pandemic, which was a time when our consumers living with chronic pain were under quite a bit of stress and distress already. And that despite our advocacy consistently with government at the time, that you couldn't bring in a change like that without bringing in alternatives and putting them for people, that was not done. So we do sort of have a bugbear with government here at Painaustralia about the way the opioid changes were done, although we did support them in general terms, and we think certainly there's a better future for people than maybe those who had to do 100% reliance on opioids. There is a place for opioids in pain management, and we still support it, but we'd love to see more people having access to multidisciplinary pain management, which is the future, and which with what medicines we have available is great. But some prescribers do feel under pressure from government that if they prescribe these things, on a regular basis to people that they are going to be targeted by the government. And that's one thing that Painaustralia is really not in favour of. So we need to leave professional judgment to our healthcare professionals, and we need to trust them as we always have. And I think that's really important. Alandia.
Yeah, Chris,
Sorry,
got
jump
something.
in, Chris. No need to raise your hand, although that is very polite of you. Jump in.
Thanks, Landell. I was just going to add the brief points with respect to opioids that in Australia, there is legislation to allow ongoing opioid prescription for chronic pain. So the Therapeutic Goods Administration changed the official indication a year or two ago, saying that opioids are not generally recommended for chronic pain other than in exceptional circumstances. So they do recognise that there are exceptional circumstances where it may be a reasonable thing to do. So then we get into this juggle, I suppose, with how different prescribers interpret exceptional circumstances. But I just wanted to make the point that there is not a unified government recommendation to say that people have to stop opioids. There's not.
Okay, excellent. Thank you for the input on that one. I know that opioids is always a tricky topic. I know from the GP perspective, they don't want to do any harm. And some of the research shows that by prescribing this stuff, it's doing more harm than good. So in the limited time that they're trying to work with you, please have empathy for the GPs as well, because I think the empathy has to go both ways and we can land somewhere that's, really effective for everybody. Now, Kim, the next question is something that I know that you can probably relate to, and I'd love your input. I think we all have a sense of hopelessness when we feel like we're out of options. So again, I'm just going to read the question to you as written by the consumer. I've run out of options. I have spent years in pain hospitals, done many ketamine and other, infusions, and they have a spinal stimulator in. I spent 6 months with alternative IV, ozone, antiviral and vitamin infusions overseas as well. I'm still in high pain every day. To go back into hospital is very traumatic. What else is there, please?
Wow. Been through a lot. Okay, I could only suggest that if all the things that have been tried haven't worked, don't go back there. For me, the medications and what have you that are used for complex regional pain syndrome never worked for me. I was allergic to everything, and I ended up, I went with scramble therapy, which works for lots of neuropathic pain conditions, and it worked for me. It has worked for a lot of people. It doesn't work for everybody. So if your condition is a neuropathic pain condition, then maybe try scrambler. Other than that, your GP and pain specialist might suggest gentle exercise therapy with your physiotherapist. Your OT might be able to assist with some things. But yeah, you're always welcome to jump on the Purple Bucket website, have a look at a couple of things there. Give me a call, we'll have a chat, and I'll help with some mental health stuff. But yeah, have a chat to your physio and see what they can do, and talk more with your GP and see what other ideas that they might be able to come up with. But we're always here to help if we can.
Yeah. And I think it's a good time to mention one of the initiatives that Painaustralia is, advocating for within the government is more sessions with allied health. So where your GP isn't helping you with these options, then we are advocating for that allied health visits as well. Joyce, did you want to add to this one?
Yeah, just a helpful point for this question, if you don't mind me adding, is that there are many pain generators and many contributors to pain. So in reading this question as well, those therapies that have been tried are targeted treatments for different target sites only, really. So depending, and I don't know the background obviously, but depending, go back to assessing what the generators are. You know, is it a joint? Is it nerves, as Kim said? Is it higher in the central nervous system? Is it a bit of all? And if it is a bit of all, knowing a plan to know, you know, which one has helped with which, and don't give hope. Don't lose hope. Go back and sift through. Oh, I tried a bit of that. That helped with that one. Okay, so hold on to the 5% of that. That helped with that one. Oh, okay, there's 1%. And re-look at it objectively with someone, and that might be helpful. Just a quick practical thought.
Yeah, excellent. Jess, you're a treating physiotherapist in a pretty high-profile Sydney-based clinic. From the allied health practitioner's point of view, and this is a tricky question that I am aiming at you for a purpose, why aren't more allied health practitioners skilled in bringing pain science theory into practice? And what do you think the barriers are there?
Thank you very much for this question, Landell. Yes, you're right. There are some, sadly, as we've discussed today, there is a lot of emerging evidence, which is not a bad thing. This is wonderful. This is exciting. And it, again, goes back to giving us all hope. But as that evidence emerges, it takes time for it to then filter down through into a practical clinical setting. So I really want to stress, I guess, for the consumers that are listening today and those that are going to listen after, that as you are seeking help, try and establish if the practitioners you are engaging with have a special interest in treating people with chronic pain, because they will then hopefully be taking the time to stay up to date with this emerging information. They will also be the kind of clinician who will really sit and listen empathetically with you and understand the complexities and the nuances to providing individualized treatment for you. So I can only say that the barriers are probably, one, the evidence is fast moving and constantly changing. Staying across that takes effort and time. Physiotherapy is very multifaceted, and not every physio will necessarily be equipped with those skills to deal with somebody's complex and individual situation as you are when you're living with chronic pain. But there are many of us out there that really do enjoy working with these with all the consumers that are here today and with these individuals. So hopefully we can continue to overcome those barriers and deliver the kind of treatment that each of the consumers really needs, and help them to advocate for themselves and be and build their self-efficacy and steer their own treatment journeys. So yeah, I hope that answers the question.
Yeah, and I think you've made a really good point there on there are clinicians out there who really enjoy working with this cohort of patients. I can imagine that a lot of the I think that a lot of the patients who have experienced not so great an experience with different allied health professionals, you walk away feeling like, well, they didn't really want me there. They didn't really want to listen to me. And I think your point about, humans are humans, and there will be people who actually enjoy treating this type of cohort and getting those results. So
absolutely,
where you can find those, you will find people who are more up to date. Julia.
Yeah, just to add, it's exciting that there are pain specialists in the physio world and in other allied health spaces that maybe people don't realise that there are special interest areas. And if you even search around and contact the physio peak bodies, for example, and the other peak bodies, you will find that list of the people. We've also got the National Pain Services Register on our website as well, and some of those are listed there. And we'd love to get more over time. So that's just a FYI that there are specialisations in all sorts of other clinical spaces, not just our wonderful pain specialist doctors as well.
And Chris, yeah.
And I would just to add the same point as Julia is making, I think Australian physios are ahead of the game, as Julia mentions, in credentialing. So there are there is training available to become a pain-titled physiotherapist at a couple of different levels. So I think Australia probably leads the world in terms of that, training physiotherapists to be interested and skilled up in the area of pain. And I think the psychologists are thinking similar thoughts, probably not quite as organised just yet, but there are moves afoot to get specific pain expertise amongst various allied health areas, which is exciting. There's hope in that.
That's an excellent point. And Kim, did you want to add to that as well?
I think Ben wants to say something first.
Oh, Ben.
Yeah, I was just gonna say like what Jess was saying, and like finding the right doctors and physio, because I went through 2 different physios and 4 different GPs before I found the right person that would really listen to what was going on for me and really, you know, was empathetic and wanted to help. And I think, you know, doing research on doctors and physios and seeing who is specializing in chronic pain was a big one for me to find the right person. So I think that was really important. And I kind of lost hope a bit when I went to the wrong people, but I did end up finding the right people, and that was a big thing for me. Yeah.
We also have a really fantastic network with Pain Nurses Australia that are doing exceptional work with chronic pain. I just thought I'd throw that in there.
Oh, that's good. Good advice. Ben, we're going to come back to you. I know that you're the youngest consumer advocacy group member at Painaustralia, but you've already had quite the journey with chronic pain already. I understand you've had a bit of a change in mindset and belief system around your pain since your journey started. And I thought this was a good question to direct to you. What's your experience with central sensitization? And are you hopeful that it can be permanently reversed? If so, how?
I am hopeful that like I did improve. I think when my symptoms first started coming on, and I was knocked around a lot and I lost hope, and it was like a downward spiral. The more pain I was in, the less I did. And then the more I stayed in bed and the more I withdrew, which just made my pain and other symptoms worse. And I just spiraled down and I was stuck in bed for a while. And I think that, you know, finding the right team, and I had like physio, psychologist, GP, pain specialist, and we worked on so many different things, and I tried so many different other things and nothing really seemed to help. But I think that just the consistent effort and, you know, working my physiotherapy and just trying to build up muscle and trying to get exercise in. And, you know, I try to change my mindset a lot because I was a bit stuck. And I think, yeah, like it can be reversed because I was stuck for a while and I was completely hopeless. But with a lot of hard work and just moving forward and taking baby steps and trying new things, I think I was able to come out of my shell a bit more, where I was in less pain. And I think it was really difficult at the start when I was starting to exercise and do more activity. I was in a lot more pain, and it got worse before it got better. But I think, yeah, like it can be reversed and it can get better as well. But I think in keeping up with what I have been doing is my nutrition and keeping up with my exercise. Yeah.
Yeah, it's just great to have that consumer perspective. I think Joyce and I were at a lecture the other night where, you know, Chris mentioned that we're ahead of the game in Australia for physiotherapists. We're also ahead of the game in pain research. And Joyce and I saw 3 pain researchers present their work the other night. And one of the takeaways from that lecture was that the belief system that somebody has about their pain is more key than any other factor to how quickly they can recover. So I think what you've been able to do is exceptional. And I think it gives a lot of people hope for being able to do the same and follow that path. Chris, did you want to add to that?
Just supporting Ben's words, and I echo yours, Landell. I think it is somewhat exceptional, Ben. I think you've done really well, and that a lot of people, for various reasons, struggle to do as well as that. So I think this is a task for all of us. You know, it's a task for Painaustralia. It's a challenge for, you know, the health professionals. It's a challenge for the consumer end. But I think you make really good points, and I like the way that you were emphasising it takes time, because I think that is a key aspect. It does take time. If we have hope in, wanting a very fast, dramatic cure, that usually is not realistic. If our hope is in doing some hard yards and coming gradually through, I think that for most people is much more realistic. So I think amazing work, Ben. I think you are a star person in working through all these things, and that's exactly where the hope potentially lies for most people if their belief is around. If I make some changes, that can be hard. If I persist with them, I can come slowly through this. They're good beliefs to have that I think align with the scientific evidence.
Yeah, and Jess, did you want to add to that as well?
Oh, I'd love to, if that's all right. And I think taking everything that we're learning today, it can seem really overwhelming for the consumer. It can feel like the impossible task, the unsurmountable kind of mountain. But I really want to stress that this journey is not one that you have to take on your own. There can be a really successful, supportive team around you. And we're here to help. You do not need to take these steps on your own. Figuring out the combination of things that can work for you is something that we can work through together. Your pain team, your multidisciplinary team is there to support you every step of the way.
Yeah. Joyce, can we add quickly?
Yeah, I'll just quickly add your own support family or friends. We've talked a lot about healthcare providers and, your pain team, but do also include as part of your plan your own preferred network of family and your support team. And of course, people who are along the journey for you, all in the right reasons and the right way.
Fantastic. So Julia, there's a couple of questions that are coming through. So we're going to address them. So one is there any Spanish resources for pain recovery? And I guess this speaks to the multitude of languages that we have in Australia. Where do we find resources in different languages? Can you help us with that, Julia?
Yes, we do have national bodies that talk about access in different languages. There's some peak health bodies, and I'm happy to put some information up about that on our Facebook page after the event. But I think it's also really important to note that Google Translate has been a huge improvement in our ability to access information. And I know as a legislator, before I was in this job, I was a parliamentarian, and we worked very hard on people using plain English in their government information, for example, so that a translation tool can be used. And I think those who are younger, particularly, who are coming from other language backgrounds, are very good at accessing those sort of tools. The more difficult part is with older people who are less technologically advanced. So I'd love to hear from people, their stories, if they're struggling with particular languages and in particular locations. Please send that through the Walk My Pain website, walkmypain.com.au. Tell us your story and we will be able to work on it. I think there's also a question about the cost of multidisciplinary treatment, Landell, and I can just go to that. Painaustralia has put a huge ask to the government on behalf of consumers to have access to more allied health treatments through their GP. And the reason we've done this is because we would like to see solutions for people that are accessible to nearly everyone across the country. So our first step, even though there are some amazing pain treatments, like Joyce has been involved in developing a pharmacist-led community model of support and care and knowledge building, and there are plenty of other innovative models out there. But the reason we've first of all gone for the GP allied health visits is because it will be easily accessible to people all over the country, as much as GPs are, and I know they can be expensive. That would then mean, so we've asked for 10 allied health visits per year instead of 5, which is currently the available number through a chronic condition management plan, through a team care arrangement with your GP. They are a bit cumbersome, but it would be a good start. So we're asking the government to fund that, and I am currently in meetings with the Department of Health, pushing very hard to try and get that done in the next year or so. We want people to have hope. We want people to also understand what multi-D is, what that really looks like for people on the ground. on a daily basis, and that body maintenance that you have to keep doing in order to keep moving and keep your pain under control, or without it taking over your life like a big monster. And we do have hope, and we are working for the changes that are needed, and we accept that it's expensive. Multidisciplinary pain management is a lot more expensive than paracetamol, and we fought very hard last year to maintain access to paracetamol, partly because of its ability for lower income people to have access to it, and the government, you know, the TGA wanting to restrict it. So we won that battle, and we'll keep fighting for you, and we'll keep fighting for more affordable treatments, but step by step with governments. You can't get everything all at once.
Yeah, and we can extend that to another question that we had, which was around medicinal cannabis. You know, we were speaking immediately before the panel about how expensive that was, and I know that Ben had some experience with how expensive that is, but is that part of the lobbying that you're doing as well to try and make treatments like that?
Yeah, well, let's go to Ben first. He can tell us about how expensive it is, and I have a bit of info about the political situation with medicinal cannabis for you.
Yep.
Yeah, so yeah, I think medicinal cannabis is very expensive. It's much more than I thought. You have to pay it up front. It's about $600 for a month to 6 weeks. It's different for each person what doses they are, but I'm on a little bit lower, and still $600 up front for a student is pretty hard to pay. I had to get my parents to do it, and like that's just not something I can really keep up with. But yeah, it's very expensive.
Yeah, look, Ben, that's right. And I think the thing about cannabis is it's become a bit of a limelight option since the changes to access to opioids, and it's something that people have a lot of hope in, and we'd love to see more and more evidence about that. I know that they still have to gather a bit more evidence about how that's working. I guess people trying it and learning from it is a great thing in that space. The political side of it is that cannabis, from a politician's perspective, there's been a big change in people not necessarily seeing it just as an illegal drug that people are going crazy on, but something that might actually be really useful for our future and for treatments. And we know that there's lobbying going on at the moment about, you know, how to manage cannabis usage with driver's licenses and that sort of thing. There are methods for all of this. It can all be done. And as evidence is gathered about the effectiveness of the treatment, it'll make all those political changes much easier. So we are engaged with the cannabis sector, and we are hopeful, and we're glad that people are trialling it and getting there. But it'll be very hard to get the bigger rebates for cannabis until the evidence is in, and we look forward to seeing what comes there.
That's fantastic. Okay, so the other thing that we sort of wanted to finish on. So we've made mention to the walkmypain.com.au website. This is where you can go on and please tell us your story about your pain. The more stories that we have helps with the advocacy that we're doing. I did want to ask a question about technology to the panel, but unfortunately we've run out of time because we had such good questions in the chat. But this is an app that Painaustralia and CAHA have combined to create. And you've got panelists here who have had input into that app. So you've got multidisciplinary care, physicians who have all collaborated on putting what they know into an app. And technology can solve the things, some of these things, like where you're trying to make it more accessible, more affordable, get that information that is in the research out into the field and doesn't even need to go via a clinician in some cases. It can go straight from the peak bodies out to the consumers. So that is one thing that we're working on. We have a call to action for beta testers. If you'd like to be a beta tester, you can visit cahahealth.com and look at what we're working on there and give us your feedback. We are at the top of the hour, perfect timing. I just want to say thank you so much to all of the panelists for being here today. We really love your input, and I love the discussion in the chat. Thank you also to everybody who made time on their lunch break to come and listen to this. I hope that we were helpful, and I hope that we left you with more hope. So thank you, everybody, and we'll see you soon.